All right, so let's log in like as a nurse to see how, as a nurse, we can continue to manage the patient that the doctor has just admitted. All right, so let me log in as Joy, as a nurse, city of. Oh, okay, let's see. So now I log in as Nurse Joy, and I come to clinics. All right, so and then I also come to this IPD. So you see that the patient that Dr. Fujiro admitted is shown here right on the nursing platform. Then you can see the information about the patient. The patient is in May ward, is in bed numbered MA3, then the patient has admitted in the May ward. Then the nurse can go ahead to start treating this patient. All right. So there are other things the nurse can do on their own dashboard. The nurse can check your bed status, check if a patient has been discharged, or most importantly, you want to start administering drugs and then managing the patient. You have to come to this side and then do more details. So when you click more details as a nurse, you can be able to see the visits of this patient, previous visits of this patient, and then you can be able to check the vital sign of this patient. If the patient does not have vital sign, as a nurse, you can add a vital sign for this patient. All right, so you can check for temperature, you can check for all these. Let's look about temperature. Let's say 36, pulse. Let's say on 30 stops, and the oxygen. Let's say 98. Um, let's say 130, 80, stuff like that. Weight, let's say person is 8, height, let's say person is 7, stuff like that. And respiration, let's say 100, remarks, and then starts. Okay, so you save your vital sign. All right, so when you save your vital signs, you see the vital signs here. All right, so you see color codes for vital signs, pulse rate, anything that shows red, it means that it's alarming. All right, so respiration 100, temperature, you see all these are alarming, but this of green is normal. All right, so this vital sign was added by Nurse Joy Kurafo. Okay, so you see this vital sign is available now for this patient. Then you can come to check the notes that the doctor has written for this patient. So you see the notes that Dr. Fijiro has written for these patients. All right, so if you go down, you scroll down, you can see all the tests that have been prescribed for these patients. Okay, you see the the investigation that have been prescribed for this patient, and the X-ray and all that, right? That's the doctor has prescribed for this patient. All right. So you can also go ahead to check the prescription for this patient. You look at it to see that this patient has been given a prescription by the doctor. All right. So you can also administer this medication by doing like this, add medication. All right. So you can go ahead to say, okay. So you can administer this drug by filling your own stops here and do add. So that means that this medication has been administered, right? So that's what the nursing can do. So the doctor admit the patient and set the plan for the patient, and the nurse continue to manage the patient in the ward, right? So the nursing also can also, if you can get the bill of the patient, that's the bill for the all the bills that have been set out for this patient, you can also get them here, right? And you can also a nurse can also look at a note, can drop a note. You can see the doctor's note as a nurse. You see, this was the note that was dropped by the doctor for this patient, and then you can also check the nurse's notes. If there are no nurse's notes, you can also add a nursing note. No, you can add notes for this patient. You can add a note regarding this patient for other nurses to see and follow, right? So that's then the nurse, you can also follow the fluid chart, oxygen charts, appointment, and all of that for this patient. So basically, so another thing the nurses can do is to, you can also come to laboratory and check the tests that have been set out for this patient, you see. So when you come in here, you can see the tests that have been set out for this patient, and then you see the status, the status is pending because the patient hasn't paid. So if you click here, you can see that the malaria parasite, and you see the bill for the patient. All right. So you can save the bill or whatever. So, but you can have information about this test that have been set out for this patient. So that's another thing the nurses can see, right? Okay, you can all of these modules are things when the lab people continue to attend to this person, then the nurses can also be able to see all of this information. All right, regarding this patient. All right. So what it means is that from the point of walking in into the front desk to the taking vitals, seeing a doctor, seeing a nurse, going to the lab, it's all seamless processes that can be captured on the EMR. So using the EMR makes it very easy for everybody to simultaneously manage a patient and have a very comprehensive data about that patient. All right. Any question, you can just go ahead to ask us. You can contact me directly, or you can talk to Mr. Henry, and we'll definitely put you through on using the EMR.